Hello there. How are you? Good. Are you relaxed about your surgery today? That's good. Well, I know you've been waiting for your laser eye surgery for a long time, haven't you? And today's the day. And as previously discussed, I'm going to be working on both eyes today. Okay. And although there'll be some recovery time for you, it won't be long before your eyesight is so much better. Okay. Now, I'm going to be using a local anaesthesia in your eye today. So there's not going to be any needles because I know that you were a little bit frightened about having to have some needles. This anaesthesia is in the form of eye drops. Okay, so no worries there. There'll be drops applied throughout the procedure in both eyes just to keep them moist, and obviously we'll check that the anaesthesia is still working. So all you should feel is a little bit of pressure in your eyes when I work on each one. There'll just be a feeling of pressure, but there won't be any pain whatsoever. Okay. So are you comfortable there? Yeah. Okay, let's just make sure you're covered. Okay. The first part of the procedure, because I know that you wanted to know what happens, some people don't want to know what happens, but the first part of the procedure, I use laser to remove the cornea, just to make a corneal flap, okay, and that's pulled backwards. Stop me if you don't want to hear any more. It's not for everybody's taste, but I know you are interested. So once that's back, can then move the laser in to do the surgery to correct your vision. Okay, and as I said before, you won't be feeling anything during this, only a slight little bit of pressure. Okay, and I'll be using this device here. Can you see? Okay, that's an eye speculum, and that will be holding your eye open for me during the procedure. Okay, so you won't have to worry about keeping your eye open, or it won't be closing, because this does the job. Okay, and again, you won't feel this at all. Okay, so let me just have inspection around the eye there. Okay, and around this eye. Alright, let's have a look at that. Okay. I'm just going to pull your eyes down 1 second. Okay. There we go. And I'm going to pull it up a little bit there. Okay, and a little bit there. That's great. So we've got no signs of infection today or anything like that, which is good, because obviously we wouldn't be able to perform a procedure if there was any infections or problems with the eyes today. So that's good. Okay. So let me just check here. And okay, just making notes of what we need to do on each eye, because obviously your eyes are different and they're going to need a different level of treatment on each one. Okay, so your right eye has the worst vision. Okay, is that correct? Okay, perfect. so you're nice and relaxed there. Good. Okay. So I'm going to put anaesthetic drops into your right eye. Okay, just keep very still there for me. Okay, and there we go. Okay, and just a couple more there. Alright, okay. Alright, there we go. That's good. Alrighty. Okay. And I'm going to pop some into your left eye now. Okay. And here we go. Okay. And some more there. Okay. Alright. That's great. Let's see how that's doing. Okay. Good. Okay. Now, the drops work very quickly, so your eye should now be numb. Okay. Can you feel this at all? Can you feel that? Oh, this. Okay, great. So I'm just going to pop in the eye speculum. Okay. Alright, there we go. There we go. Lock that in place. Okay. Are you comfortable? Good. Okay. Right. So I'm going to be bringing the piece of equipment across, which is going to do the first part of the procedure, okay? So don't worry, it will be quite close to your face, okay? And you might just feel this little bit of pressure in your eye. So just relax there for a second, okay? Can't tell you to close your eyes, unfortunately, because that's not possible now. Okay, but just relax as much as possible for me. Great, okay. Let's just get this set up. There we go. Okay. So, bringing that in. I've just got to line this up. Okay. Gonna line that up nicely with where I want it. Okay. Alright. Okay. And okay. Keep your head really still for me now. Here we go on the first part, okay. Alright, there we go. You feeling okay? Good, good. Okay. Keep very still. That's looking great. You can't feel anything uncomfortable, can you? Just that pressure. Okay, that's normal. Okay, right. Just need to recalibrate this a second. Alright, and here we go. Okay. I'm going to bring that in a little bit closer. Okay. And relax for me, and here we go there. Okay, right. You okay? Good. Keep very still for me. You're doing great. That's fabulous. Doing great. Doing great. There we go. Doing great. Okay. More drops. Okay. Okay. Let's have a look. So bring that back slowly. Bring that flap over. There we go. Okay. Let's just have another look there. Okay. Feeling okay around your eye there? Good. Okay. That one is looking amazing. So, I'm just going to remove the speculum from that eye now. Okay. Okay, there we go. Alright. How does that feel? Excellent, excellent. So you're ready to go with your left eye now. Alright. Okay. So let me just make sure that's feeling nice and numb. Can you tell me if you can feel any of this? Okay. And this. Okay, and this. Alright, that's great. Okay, so in with the eye speculum on this side. Okay, get that in there. Alright, and just get that in position. And okay. How's that feeling? Yeah? Okay. So, calibrated there. And I'm going to bring this across now for this eye. Okay. How's that? There we go. So same with this side. I'm going to do the first part where I make a corneal flap and then on with the actual treatment for your vision. Okay. Again, you will feel a little bit of pressure, but there should be no pain. If you feel anything, please let me know. Okay. That's good. Okay. So, you ready? Great. Okay. Just. Okay. Just see that. Alright. Okay. And I'm going to remove that corneal flap. Okay, and some drops for this one. Okay, there we go. You're doing great there. Let's just have a look. Okay. Yep. All right. Okay. Just need to move this a little bit to get this in position for this particular eye. There we go. Let's just, I'm happy with that. There. Okay. Okie dokie. Nice and still for me now. Okay. And great. Okay. There we go. Okay. Are you feeling okay? That's great. Okay. There we go. Okay, and feel okay around your eye there? That's great. That's great. Okay, some more drops for you in this eye. Okay. Alright, and some more there. Alright, let's have a look now. That one looks good. Let's look round here. Yep. Okay. Super. Okay, let's just replace that corneal flap for you. All right. You see now. Okay. So I think we're looking really good on both sides. Okay. Yep. Both sides there. How does that feel now? Good. Okay. So let me just remove that eye speculum. Okay, there it goes. There you go. I'm just going to give you a couple of minutes just to get yourself together there. Okay, so just lie there very still. Okay. Okay. How does that feel now? Okay, so the pressure's gone. That's good. That's good. Okay. So, obviously, you've got your sunglasses with you, haven't you? And someone's here to drive you home because your vision isn't going to be brilliant for a little while, I'm afraid. As you leave, we're going to give you a special eye mask, which you must sleep in. Okay, for the first couple of weeks, if you sleep on your tummy or side or your back, it doesn't really matter. You still need to wear this special eye protector, okay? And I know we've spoken about this in your consultation, but what I really need you to do now is to go home with those sunglasses on, and when you get home, go to sleep. You need to close your eyes and go to sleep for as long as possible, a good few hours if possible. Okay, because your eyes are very vulnerable just at this first period after your treatment. Okay, and obviously we don't want you to suffer any negative effects. All right, so go home, relax. There's also some drops that we'll give you to put in your eyes as well. But I can see that they're looking really good now. Okay, and it will take your vision a while to clear. So don't worry about that. If you start getting any irritations, anything you don't feel is quite right, of course, let me know. But it looks to me like they're going to be brilliant and you're going to have so much better vision soon. All right, so my nurse will escort you out and then let's get you on your way home to recovery. Okay. Been a pleasure seeing you today. Take care now. Bye-bye.